Now, when we're looking at neurotransmitters, you want to be in balance. So too much or too little both create a lot of troubles. The key is to really figure out where you are and then start to try and get them into the right balance for your biochemistry so that your mood and energy and ability to interact with the world is as optimal as possible. Now, the one I want to talk about today is a copper overload. So copper is a really important nutrient in the body, and it plays into many different reactions. And one of the things that can happen for many people is that we can end up having too much copper. And there's sort of two things that go on with copper and I'll explain how it creates troubles and what some of the symptoms are like if you have a copper overload. But think of it this way, the two things are that first, copper needs to be balanced very effectively with zinc. Zinc and copper are teeter-totter nutrients, and they need to be in the right balance. And for the most part, for optimal brain function, you really need to have copper and zinc about equal amounts. And we look at these and we know what the reference ranges are like, and we know where the optimal zones are supposed to be. But many times there's a big imbalance, and zinc goes down and copper goes up. And so part of it is that you want copper and zinc to be closer to a one-to-one relationship, and if that gets really skewed where copper is much higher than zinc, that can start to cause some troubles. The other thing is sometimes just if copper is too high, and there's a difference between bound copper and free copper. And if you don't have enough of a key nutrient called ceruloplasmin, which basically binds copper, then one of the other problems is that you can have too much free copper bumping around, and it's the free copper that aggravates a reaction that can actually create a whole lot of different troubles. So when we're looking at this, we're looking for your ratio of copper and zinc, and we're looking for the amount of free copper that's just bumping around basically in your brain, causing some troubles. So many patients with mental illness have a genetic tendency to elevated copper levels. So we see that a lot of these patients that deal with some of these different issues like anxiety and ADHD and depression have a genetic tendency to elevated copper levels. And this can predispose them to a number of different psychiatric disorders. Ultimately, each person is going to react in a slightly different way to the different biochemistry. You could have a couple of people that have a copper overload, and one of them could have very bad ADHD, and another one could have severe anxiety, and another one could have depression from it. So it depends on how it plays out in that person's body. But nutrient therapy can assist in normalizing the key imbalances that take place. And when we look at a copper overload, the big imbalances occur with two primary neurotransmitters called dopamine and noradrenaline or norepinephrine. And what I love about nutrient therapy is that for the most part it's relatively inexpensive and it has very few side effects, unlike a lot of times when we have to use heavier medication.